My name is Mara Baker, and I'm doing a presentation on Capgras syndrome. Capgras syndrome is a psychological disorder which causes the sufferer to believe that people that they recognize, such as their loved ones or friends, have been replaced by identical lookalikes. In some cases, the patient could believe that these imposters mean to cause them harm. The first documented case of Capgras syndrome was in 1923. Joseph Capgras, a French psychiatrist for whom the syndrome is named, documented the case of a woman referred to as Madame M. Originally, the syndrome was called illusion des sosies, which can be translated literally as the illusion of lookalikes. Although the first documented case was in 1923, there could be older documented cases. In many cultures, there's folklore surrounding loved ones, usually children or babies, being abducted and replaced by lookalikes. Usually these stories involve a fairy creature. In the 1800s, in Irish folklore, these are called changelings. The folklore is fairly pervasive. Most cultures around the world have something similar. So I think that it's possible that these are older cases of Capgras that weren't fully understood. Initially, Capgras syndrome was considered a purely psychiatric disorder, usually connected to schizophrenia. It was also considered a purely female disorder and associated with hysteria. In the 1980s, coexisting organic brain lesions were recognized. These lesions were originally thought to be essentially unrelated or accidental. Today, it's understood that this is a neurological disorder, which primarily results from these brain lesions, or from degradation of the brain in certain regions. Capgras syndrome is categorized as a delusional misidentification. Symptoms of Capgras are sometimes associated with Alzheimer's disease or dementia, schizophrenia, especially paranoid hallucinatory schizophrenia, and in rare cases, epilepsy. A study done by Darby, Langarine, Pascal Leon, Prasad, and Fox, called Finding the Imposter, took 17 cases of lesion-induced delusional misidentifications. Each patient was required to have a delusional belief involving the sense of underfamiliarity for a person, Capgras, or a similar delusional misidentification. The cases also needed to have sufficient clinical data to determine the nature of their delusion, an acute localized neurological injury, and imaging showing the lesions with enough clarity to trace the standard brain atlas. All 17 cases looked at within this study were collected, and the lesions were identified and their locations mapped onto a common brain atlas. Regions commonly involved in familiarity perception and belief evaluation were identified using meta-analyses of previous fMRI studies. In this study, all 17 cases had lesions connected to the region of the brain most activated in fMRI studies of familiarity. 16 of the 17 cases had lesions connected to the region most activated in studies of component of belief evaluation. Capgras syndrome is not a rare condition, but an uncommon one, which is probably frequently overlooked. Capgras syndrome seems to occur more frequently in women, African Americans, and schizophrenics. A study done by Doan in 1986 estimates that about 0.12 prevalence of Capgras syndrome in the general population. According to Mazzone in 2012, a combined treatment of antipsychotic medication plus an SSRI can lead to a good clinical outcome with remission of the psychotic symptoms in Capgras. Neuroleptic drugs have also been used in patients with Capgras syndrome, although without complete remission of positive symptoms. Another study showed positive outcome in a patient with Capgras syndrome after treatment with an antidepressant. These are my references. Thank you for listening.